I'm a family physician, and I've actually done both streams. I've worked in private practice, both in a rural and an urban setting. And in the last year, I took on an academic role where I still see patients, but more as an organizational role at the university, as an assistant program director for the undergrad education. In private practice, typically you're seeing patients pretty well on a daily basis, and so it's all to do with patient care. So you're seeing them in the office, making diagnoses, writing referrals, maybe talking to specialists that coordinate their care, and it's all in a community-based setting. My current role, I still do that, but only half time, and then the rest of the time is spent sort of organizing and helping teach first to fourth year medical students. And so it's a completely different job, where it's less patient focused and more teaching and education focused. I really like both because it adds variety to my day. Not one day is the same as the next. Half my time is spent in the clinic, and the rest of the time is attending meetings or coming in here and writing out presentations and administrating over, I'd say, a student who's struggling, right? So student remediation is part of my job as well. For a clinical day, I typically review my labs in the morning, typically, and then I go in and see my patients. I'm booked fairly lightly because we need to have time when usually the resident or the student sees the patient first, comes out and reviews with me, and then I'll go in and review the patient with the resident or student together. And so that process takes quite a bit of time sometimes if it's medically complex. And so, and then the cycle just repeats itself until the day is done. The thing with family medicine, as opposed to almost any other specialty, is that we see the patients over and over again. You develop a relationship. You end up not just seeing them, you may see their spouse, you may see their children, you may see their parents. So sometimes you see 3 or 4 generations in the family, and that's really rewarding to feel like you've made a difference or you touched their life in some way. I've always known I wanted to be a physician, so honestly, from high school onto university, it was always slated towards getting into medical school. So doing all the prerequisites and applying to medical school when it was possible to do so. One of the myths of the human body is that it's unbreakable. And unfortunately, especially since my target, our focus is the high school student, there's lots of people who think that their bodies are unbreakable. I mean, you watch movies, right? People get hurt and they're limping, and then 2 days later they seem like they're back to normal.
Still able to jump over a fence and catch that bad guy.
That's exactly right, and that is so not true. So, I mean, surgery especially seems like such a wonderful thing, but you know what? Your body, the way it was built, the way you're born with it, works the best. And so if we use it and abuse it, if we smoke a lot, if we get into accidents that were preventable, we can only fix so much, but I can assure you your body will suffer the consequences of whatever damage you've caused it. And I just want people to have respect for their bodies. It's a well-oiled machine, but you gotta take care of it. And that's a major myth I wish to dispel. It's not like the movies.